Okay. 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 Yes, you can prepare and you can start.
Okay, how may I address you during role play, sir?
You can call me Lincoln because my name is Abraham Lincoln.
Okay. Good morning.
Good morning, nurse.
My name is Neena, one of the registered nurses who is working this hospital casualty ward. You are Mr. Lincoln, right?
Yeah, of course, nurse.
Okay, Mr. Lincoln. So how are you feeling right now? And are you tensed now?
Actually, I am very much worried. I am concerned regarding my problem. I don't know why the doctor is asking me for blood transfusion.
Yeah, it's a quite reasonable concern from your side. So let me explain to you about that. First of all, you don't need to upset about the procedure. I can rest assured your tensions regarding the possibility to get the infection through the blood transfusions. So, Mr. Lincoln, um, the prevalence of the infections through the blood transfusions is very rare because we will do all the necessary arrangements before implementing every steps because your fundamental health is our first priority. So usually before taking the blood transfusions, we will screen the donor and the doctor will prescribe or order some of blood test in order to find out there is any sexually transmitted disease or blood transmission, blood-borne disease. After the confirmations, usually we collect the blood from the donor. Is that clear now?
Yeah, of course, nurse. But I am worried about this blood transfusion because I have read in the newspapers and I watched in the televisions that people are affected with, infectious diseases like HIV and AIDS and other things.
Yeah, it's a quite reasonable concern from your side, which means that you are very cooperative to us for this procedure. So earlier I mentioned that the prevalence of getting infection through the blood transfusions is very rare because all the hospital, especially our hospital, we are followed some rules and regulations in order to prevent the blood infection through the blood transfusions. Usually, we will during the time of blood transfusions, this procedure will be taken under the complete sterile conditions or environment. So we will use a new syringes, new linen, and the nurses who is assisting for the blood transfusions will always wear the sterile gloves. So you don't need to be worried about the infections that coming from the blood transfusions. Is that clear now?
That absolutely clear, nurse.
Okay. In addition, during that blood transfusion time, the nurse will monitor you closely. The nurse will assess your vital parameters and other possible after effects you may experience, such as shivering and nausea. So these symptoms may, some people may experience these symptoms during the time of blood transfusions or after the time of blood transfusions, but this will last only few means 1 or 2 hours after the blood transfusions, and after that you will be able to do your normal day-to-day activities. So don't be upset about this procedure. How does that sound, Mr. Lingan?
Yeah, that's absolutely fine, nurse.
Okay, so would you
But
like to
the
ask me
thing
more
is,
questions?
are there any after effects or ongoing problems because of this?
Yeah, that's a quite reasonable concern. Some people may experience some kind of after effects, such as shivering, nausea. Some people may lose consciousness too. But these things can only happen when the critically ill patients. Some people who are generally well don't experience such kind of potential after effect during the blood transfusions. Is that clear now?
Yeah, of course, nurse. That's exactly clear.
Okay. So along with that, I would like to tell you is that in your case, the blood transfusions is profoundly beneficial in order to prevent further kind of complications, or you get a complete recovery. So I know that from your case note, I can understand that you were admitted here following a road accident. During that time, you lose some bloods that we expected. So that's why you require blood transfusions. I hope it's clear to you. Am I correct?
Yeah, of course, nurse. That's very clear. But yeah, according to your words, I feel that I'm safe and comfortable. So thank you very much for your care and concern and your suggestions, nurse.
Okay, thank you, Mr. Lingan. So I know that you are quite worried about this procedure. So honestly, I can say you don't be upset or you don't need to be worried about this procedure, because we all are here to help you. We will monitor you closely, and we will be provide you a complete care during that time. So you don't need to be tensed about that. I hope it's clear to you, right?
Yeah, of course, nurse. That's absolutely clear.
Okay, thank you, Mr. Lingan. So in case any additional information is deemed extremely relevant, please do not hesitate to contact me. So kindly wait here. I will do the necessary arrangement for the blood transfusion. So thank you, Mr. Lingan, for listening this.
Yeah, that's very nice, nurse. Thank you once again.
Thank you.
Yeah. So now let us see the feedback. Okay. You're actually doing very nicely. No problem. You have a style now. Very wonderful style you have. Keep the style, okay, in regular fashion. Every day you do like this. Don't do one day you're doing, one day you're not doing, will not help you. So do one session each day. So that will be really beneficial. Okay, at least one session every day. I told you do sessions. If you cannot do two sessions, no problem. You do at least one session. If you do two sessions regularly, I'll give you two sessions. Otherwise, what happens? It will drop to one. And if you don't come, that also will not be there. So what is the use? Again, you will be losing some chance to improve. So be standardize your quality. That is what I will tell you. Standardize your quality. So that would be really beneficial. That would be very wonderful. That would be really wonderful. The next one is uh, you can see you have said in case you follow all these things, it would be extremely beneficial. So like that one, some sentences, standardized sentences you can use. Not only writing and speaking also you can use. Okay, you have to be a little bit formal style because you're a doctor. You cannot do informal style because this is a professional practice session. Okay, so try to be strict in the vocabulary also. Take good vocabulary, avoid ordinary vocabulary, and improve your quality. Then apart from that, what you are supposed to do is you can create an impact on the patient. Okay, they should be impressed by the way how you are talking. They should feel that you should touch the heart of the patient, not the brain of the patient. You should touch the heart of the. That means your mission is accomplished. So until and unless the person feels very happy, okay, nothing is going to happen. Is that clear? So now I will correct your letter. Which letter should I correct? You told me.
I tagged you, sir.
Yeah. So this is Sydney Lawton regarding Mrs. Sydney Lawton. So Sydney Lawton case notes. You go to Telegram and search Sydney Lawton case notes. Okay. So send me your tag your letter.
Yeah, I already tagged the letter and case note.
Okay.
Jasmine Thompson.
Yeah. Okay. Right. Now let us see your letter. So you have already tagged the letter. Okay, let me go there. Neena Johny. Yeah. Yes, page number 24 and writing is here. Yeah. Yeah. So Sydney Lawton. Miss Neeta Roberts, in-home nursing service, 79 B-side Street, Bayview, 15 July 2017. Dear Miss Neeta. What is this, dear Miss Neeta? Dear Miss Roberts, no? Why you wrote dear Miss Neeta? Is she below 18 years of age? Huh? First name? You have to use second name, Miss Roberts. Dear Miss Roberts, that's a mistake. So this is how mistakes happen. If you are not regular. Okay, Roberts. Yeah, regular, very regular. I know that one, but so if we miss 1 or 2 days, and like this happens, so be careful. Regarding Mrs. Jasmine Thompson, write a little bigger font. Date of birth 1 July 1942. Mrs. Thompson, who has been recuperating after total shoulder replacement surgery. Which total shoulder replacement surgery, left or right? Left or right? Total shoulder. Two shoulders are there. Which one, left or right? So that is incomplete information, confusing information. Now I have a doubt now. Which shoulder?
Okay.
Now whom should I ask the information about this? So you are avoiding some relevant information which is important, correct?
Yes, sir.
So which shoulder, left or right? Huh? Okay. Left or right? Okay. Total shoulder replacement surgery. Requires regular home visits for medication compliance. Regular home visits not for medication compliance. Regular home visits for monitoring medication compliance and assistance for performing daily living activities. Following the discharge back home today. Very good. On 11 July 2017, the surgery was performed and the physiotherapy exercises have been initiated to regain mobility. No need the mobility. Regain mobility. regain mobility. Okay. Regain mobility. The next one. The pain on the incision site was effectively managed with analgesia and cold cold compress, which needs to be continued for 4 hours daily. The dressing changes. The regular daily dressing changes. The regular daily dressing changes have been provided, not performed, provided. Changes have been, not has been. Have been performed. Have been provided. Okay. The dressing has been changed regularly on a regular basis and no signs of infection were noticed. Consequently, the vital parameters and neurovascular assessment are unremarkable. Okay. Mrs. Jasmine, who is a widower, okay. Mrs. Jasmine, who is a widower, comma, lives alone in a single story house. In a single story house. In a single story house. 1 second, please. Hello? Yes? So, however, a daughter will stay with, the daughter will stay with her, not will be stayed. The daughter will stay, the daughter will stay with her for 1 month post surgery or after the surgery or following the surgery. Very good. She has the history of chronic. She has a history of chronic right shoulder osteoarthritis and is on medication, which includes including Voltaren 550 mg and Panadine Forte. That also is okay. Panadine Forte, P capital letter, F capital letter, I think. Panadine Forte is a brand name. Check it out if it is a brand name. Based on the aforementioned circumstances, support for implementing day-to-day activities and subcutaneous administration of Clexane, spelling NE, for 4 days as deep vein thrombosis, DVT, you can say deep vein thrombosis, would be profoundly beneficial. A sling on the right arm is required. A sling is required on the right arm. A sling on the right arm is required. And yeah, first page is over. Next, second page. Yeah. Lifting heavy objects. Lifting heavy objects should be avoided. Not has been avoided, should be avoided for the next 4 weeks. The next, the previous, the next, like that. The next 4 weeks. Community hydrotherapy is advised to relieve the pain. Community hydrotherapy is advised to relieve the pain on the surgical area or surgical incision site. Better words, incision site. Follow-up appointment, a follow-up appointment for the removal of staples or to remove the staples, that is also fine. After 10 days in the outpatient joint replacement outpatient department, orthopedic joint replacement outpatient department. Okay, has been scheduled. Very good. In case any additional information is deemed extremely relevant, please do not hesitate to contact me. Good. Yours sincerely, registered nurse. That's fine.
There's a problem with the articles.
Yeah, it's okay. Lot of improvement is there. That's no doubt regarding that. Lot of improvement is there. That I can tell you. So this is Neena, Johny. Yeah, any doubts you have, you can ask me, Neena. Because
No,
if you have any doubts, you can ask my gallery. I'm sending the corrected versions both.
okay, sir. Thank you.
Happy Teachers Day to the best teacher in the world, Amol, Dr. Amol. I'm trying to be the best. I'm trying to be the best. I'm not the best. Happy Teachers Day to the best teacher in the world, best mentor and guide. Oh my God, this is too much. Yeah. Okay, any doubts are there, you can ask me now. Otherwise, we are done for the day.
No, sir, it's almost over. Thank you.
Okay, fine.